Hi, I'm Dr. Del Rosario, and today we will be talking about sore throat and strep throat in children. Overall, there are two general types of sore throat infection, one caused by viruses and one caused by the bacteria called Group A Streptococcus. So when you hear the term strep throat, that refers to sore throat infection caused by the strep bacteria. The major difference between sore throat caused by viruses and sore throat caused by strep bacteria is that viruses will go away on their own, whereas bacteria will require treatment with antibiotics. So how do we tell the difference between the two? The first clue has to do with what other symptoms are present. With viral sore throat, there tends to also be runny nose, congestion, or cough, and there may or may not be a fever. With bacterial strep throat, however, there's almost always a fever, minimal or no congestion or cough, a very red and swollen looking throat, and painful or swollen lymph nodes in the neck. Kids with strep throat will also often have a headache or stomach ache. These are the classic symptoms of strep throat in children that your doctor will ask about and look for on the exam. A useful tool we have in clinic is the rapid strep test, which involves swabbing the back of the throat to look for the presence of strep bacteria. It's not 100% accurate, but it's quick and easy, and the results come back right away. If it's positive, that confirms strep throat. If it's negative, your doctor will use their clinical judgment to determine whether it's truly negative or if any additional testing is needed. So in terms of treatment, if it's strep throat, your doctor will prescribe a 10-day course of antibiotics. It's important to finish the entire 10-day course in order to get rid of all the remaining bacteria in the throat. If left untreated or only partially treated, strep throat can actually lead to complications like scarlet fever or rheumatic fever, which can also affect the heart. But if it's a viral sore throat, then antibiotics are not required. Remember that viral infections do not get better with antibiotics. Our body will fight off a virus on its own. Meanwhile, you can give Tylenol or ibuprofen as needed for fever or pain, have your child drink lots of fluids, and offer things like soup and warm lemonade to help soothe the throat. In terms of when your child can go back to school, generally after 24 hours of starting antibiotics, your child will no longer be contagious. And for viruses, generally kids can go back to school once the fever is gone. Finally, the best way to avoid getting sore throat in the first place, or to prevent spreading it to others, is by not sharing utensils or beverages and to practice regular hand washing. For Live Life Healthy, I'm Dr. Del Rosario.